आदर्श नाही का आदर्श नाही चांगलं मोठा आहे सांगते काय माहित आहे का
Uh, Unfortunately, only 3% are there, and in that also one thing is new one. So Vinayak and Anjali, 2% are only there as far as this statistics understanding is concerned. Anyway, we are not concerned with whether 1% or 2%. We'll continue with our talk on statistics. So, first we'll start with the today's objective. Ultimately, we need to integrate the three things together. The research subject which you want to do it, which kind of epidemiological study you are going to do for that particular research, and which statistical analysis you are going to do. This things we'll be discussing today. As far as Anjali ji is concerned, she has already prepared something in her mind. I don't know about Vinayak. Can you switch on your video and tell me what is your topic of study?
Uh, yes, sir. I was thinking about practicality of antimicrobial stewardship program in tertiary care hospital, especially in the rural setting.
So which antibiotic should be used or antimicrobial should be used? Something like that.
No, no, sir. Actually, I was thinking about first, there is a pre-interventional survey where we find out what are the antibiotics prescribed, what are the trends in prescription of antibiotics, how many antibiotic resistance tests are conducted, what is the resistance trends. That is the pre-interventional survey. In the intervention, we can recommend the tertiary care hospital about the changes which can be done, and after that, in the post interventional survey, we can have two different objectives. First is the short term objective that the prescription trends of the antibiotics have been changed, and long term objective is that the resistant trends in that area has changed.
Okay. So I think once we finish the topic of Anjali ji, we'll come to you. Now, this is a basically a learning exercise that whatever we are doing, where do we apply epidemiology and where do I apply the statistics? This is and core understanding will develop by the discussion only. Now let us. You should have your pen and paper. Even Panthini should have a pen and paper with her to note down and then plan it out. I think she has already tried to work to find out the prevalence of morbidity, various kind of morbidity among the first time with the students that she had done a study. So
Yes,
that
sir.
study can go further and she can refine that also.
Yes, sir.
So now, Anli ji, you can talk whatever you want to talk about your study. And basically, we would like to find out where do we apply epidemiology, where do we apply statistics, and which method you are applying. When we call about epidemiology, you should talk about the time, place, and person. And you should also talk about various methods, whether it's a cross-section study or the retrospective cohort study or prospective cohort study or both combining, or if there is a case control study or It's a interventional study in which you can have a randomized control trial also. So that kind of the insight we should develop, and which one is the best for your particular objective and for your population, etc. So that your project proposal is complete, well defined, and then you can submit to some places. So now you can talk about your topic. In future, you should come out with
Yeah.
right?
So yeah. So it's a prospective study
Yes.
first, and it's a longitudinal study, not a cross-sectional. We took a sample, found out how many are obese, and then we went to do a interventional in
A bit
them.
louder because we want to record this also, so that in future you can refer again. A bit louder.
Yeah. So I want to do a prospective study first. Second, it's a longitudinal study. And because you have to find out how many students are obese in that, whether it is a new or whether it is a old one also, and then intervene and then make them into two groups, do some intervention, like half the group we give a exercise, half the group we tell them to diet, and see which is most effective.
So
Yeah.
you need to first find out the variables which affects the obesity, which leads to obesity. Although you have
Obese.
read in the books, but before you start the
Okay.
intervention can be a group specific or person specific, because
Okay.
was the scientific temperament or statistics wise you are correct that you have given two groups, etc. But epidemiological you are not correct, because what you advise those, or you got the people who are already doing exercise, you are putting them in exercise group, right? Already doing dieting, putting them in the dieting group, and then you are trying to compare. That may be a failure. So,
Okay.
so in this case, if possible, you need to first define the variables which you would like to study in your
Study.
yeah. So
Okay.
when we use the word variable and parameter, there is a slight difference. When you study a population, at that time, the observation we call it as a parameter, height, weight, etc. And we are doing a study in a sample. At that time, we use the word variable, right?
Okay.
So, all of course, both are interchangeable, but this is a usual dicta. And the definition of population is all possible observation. That is a population. So,
Okay.
I talked about the question that whether you can do the statistical analysis or significance of test apply in an individual or not. Individual can have so many observations, and that observation before and after you can always compare. So population in statistics doesn't mean the number of people. Right? It's a all possible the observations. For example, if you are the person is an individual, but date wise, if you find out how much calorie he took, how many proteins, vitamins, etc. Whether he took fruit, yes or no. That if you prepare a format of for an only individual,
Okay.
you have a date if 365 days. So all those records, right? That becomes your population, and from that you can take a sample and find out whether your sample was true or not. For example, you are trying, you have 365 days record, and you are picking up only the 11th day, that is Agyaras, and then to the whether is the representative of sample or not. At that time, it may not be. So it's not a question of individual or population. Is in statistics is the summation of the all, or summation of the is the collection of all the possible observations. That's a population. So now in your case, you want to find out obesity.
Okay.
Because in this obesity, first you should try to do the pilot study. And before you do the study, you should verify your format. So have you prepared the format or yet not?
No, no, not yet, sir. Not yet.
So
Okay, so-
whenever you prepare a format, you prepare in such a way so that it will be useful to you for future also.
Okay.
Applicable to the Vinayak ji also, Pandini ji also, everywhere.
Yes.
So,
Yes, sir.
format should contain first the place, the city,
Clear.
the
Okay.
district, etc., etc. Then the person, that variables, then time variables, all those. So what will happen when you prepare next time?
Yeah.
Your
Yes.
address module, person module, time module, that remains the same.
Yes.
So, next time when you do it will be much easier. And AP info particularly,
Hmm.
when you start preparing your form, it gives a template. And you can prepare your own template also. It's a quick method of preparing your tool. And if
Okay.
you're not seen in AP info, you should try to see that. The next thing would be, now we only take few variables about exercise, for example. In exercise also doing or yes or no. If exercise doing regular or irregular, how do you define regular? Number of days per
Week.
and also minutes per day. Now all these things are some person might like me, such a irregular that you can't
Hmm.
in that case, then you need to use a software for data collection.
Okay.
So that person enters a daily or weekly summary like that. And that in that case, randomly you need to cross check whether the data is correctly filled up or not. And then you can judge with the record. All these things, meticulous thing required for the purpose of research.
Yes, sir.
So now suppose in your diet, so there's a diet, the sleeping habits. So in lifestyle habits, there are a lot of things are there. And when you want to change the habits or you want to define it, whether the exercise was important or not, all those things, more clearly you define, more clearly you will get the results. So try to prepare a tool, just then fill up 10 or 15 and then try to do analysis in AP info, then present the thing and then try to take help of colleague. We'll be discussing only the statistical part of it, but with the physician or with the pediatrician, you can discuss obesity in detail.
Okay.
Now, the analysis which you are going to do in statistics for this, have you seen which statistical test you are going to use?
The population, the number of is more than 30. So we will use a Z-score if it is less or T if it is more.
So how much will be your population?
Population is like 2 lakhs. Whatever will you say? So the number of students which I'm going to take is like 350 to 400.
400 students you are going to study. Which school you will select?
A municipal school.
But there are so
Which-
many municipal schools in Bombay.
Yeah. So one municipal school, sir, not more.
So the one municipal, so when you are doing the study and when you apply, your study will be applicable to that school only,
Okay.
not to even that area.
Yeah.
So if you want to study a 400 students in a single school,
Hmm.
but if you have resources, you should ideally you should go for, let's say, around 30-40 schools. In that, take randomly 10 students from each school. That is
Okay.
study. But because of feasibility, you are just trying and learning. That's okay, even if you take one school and do the study.
Hmm.
Remember, the way you take a sample, the way you choose the population, your study is applicable to that particular population. So doing a study in a Bombay, in a one school, and then you should not shout that in Bombay the situation is like this and Maharashtra situation like this, or some in America you can say in India we have like this. So that is very important. How you have the population. Now let's say that you have found out 4-5 variables which is related to this. The dietary habits in the calories, number of time eating, and exercise, or regular or sleeping every, all those you have found out. Then statistical analysis says that these are the most important factors, because I hope you have seen the logistic regression analysis that command in AP Info.
Yes, sir. I went and saw that AP Info, but the guideline doesn't help us to say. It says it's not there, that page, that guide which I wanted to read and go further. It doesn't show, sir.
The manual definitely gives each and every command. They give the detail how to use it, as in examples. So that is already given in that map. So it is much better to practice along with that manual. So that will be easier. But if you don't understand a particular command, then I can, because this is just to show you that this is how you can use it. I will show you the manual that where it has given.
The stepwise approach, sir, which you have given, that also we have to read, no?
Yeah, anything. See, is you see whether you can go with a steamer or go with a boat. That's up to you. There are a lot of resources found because the AP Info is working so long. There are so many. Even there is a group of AP Info people who gives you a solution, etc. But our purpose is how to use that in our perspective. So you will be using table command, frequency command, and then the for better analysis, you have the logistic regression analysis, in which you will find out that these are the points which are most useful. And then you will have the, suppose you want to do the intervention study. So instead of taking only 2 groups, exercise and diet, it will be much better that I am talking about ideal, then you can do whatever you want. Let's say we have 20 schools. In that, randomly divide 20 schools into 2 parts, 10 schools here, 10 schools there. And provided these 20 schools are homogeneous. If they are heterogeneous, for example, then you divide into 2 groups, 10 private schools and 10 municipal schools. If you only municipal schools, then you can have 2 areas, something like that. Then the homogeneous groups, 10 schools, and that homogeneous group you need to divide into 2 for randomization, or still better, divide into 3. One group diet, other group exercise, and other group nothing. Or diet, exercise, and diet and exercise. Diet alone, exercise alone, and diet and exercise. And if you want to have only 2 groups, it is much better. One group, don't touch it at all. And another group, go for integrated approach. Diet, sleeping, it is regular lifestyle change, exercise, pranayam, etc., etc. And that integrated approach in one group, control group, nothing doing, that will be still better. And for ethical purpose, once you get a result after 6 months or 3 months, then the group which you had left out, try to teach those things in that group also. And in that group, go for before and after. So let's say you have 2 groups. you have 6 months study. So first 3 months, study group and control group. Next
Yes.
3 months, continue study group intervention, and another group, control group, also start a study. Means intervention start in that also. So that you can have a before and after in that control group also. Nothing doing, that 3 months also you will have. And at that time in a study group, naturally you will have a difference at a 3 months and difference at a 6 months, right? In this case, the most confusing thing is, what do you compare? You have two groups. You will compare, let's say group A and group B. In group A, you compare before and after. In group B, you compare before and after. And before you compare between A and B, and after you compare between A and B. And you have something else also. Compare the differences between two groups and whether these differences are different or signal different or not. So this kind of analysis, when you start doing it, there are various ways of analyzing it. And as a student, you should try to go for each and every permutation and combination.
Yes, sir.
That's idea.
Okay.
So how
So,
much?
sir, for using that AP info, we have to first fill the data in our Excel sheet or whatever, and then only it comes
So,
in that AP.
see, you have two options. If you want to go do a large study, it is better don't to use Excel at all. Go
Okay.
for AP info only and give AP info to the surveyor, or even you can teach the teachers also, so that they themselves do the data entry for you. Or you can have a Google form, or you have an app that is known API Collect, EPI Collect, COLLEC. So API Collect you can use where the people can directly enter the data from their mobile also. So suppose I want to do a study about this obesity score right now, all over the India. I can prepare the app on API Collect, or I can prepare a form in the Google quiz, or even simple Google form I can prepare, float around the India, and specifically I can take a sample and those states, those districts, the school within that, I can find out and give them, and then we can do it. But Google Forms or online collection of the data has to be validated by person, at least 1% or so that you are very sure that you are not doing either or there, something here or there. So I think this much now. And let me ask you a question. Where do you apply the standard error of difference between two mean? Just give me example.
Standard error of
Difference between two mean. In this case, if you are taking this study, where will you apply?
That is a two sample comparison.
But which two sample you will compare, and which parameter or which variable you will compare?
Two samples will be our group A, where I will use
And
group
what will
B.
you compare?
That is the I will compare the weight and the body mass index BMI.
So you will
the
compare body mass
weight
index.
and height, then calculate the BMI.
So you will be going to compare mean BMI of two groups, right?
Yes.
So it will be because your sample size is maybe around 400 or so. So is a Z, which suggests the standard error of difference between two mean. And based on that, you will be finding out Z. Okay. So if you are doing manually, but if you are going to use AP info, which command you are going to use?
Yeah.
Tell me. So in that, you will be using means command. And in means command means BMI versus group. So group A and B. So in this case, the data should not be side by side. It should be continuous data set in which it will be something like that, serial number, then the BMI, then the group A or B. So continuous data set will be there with you. So the info will give you, because if you have two separate files, then you need to merge the file, one above, other below, copy paste. That is a continuity of the data is required. Otherwise, you will find the which mean from where I find out. It's not like that. So mean command you should use. Now, shall we go to the Vinayak's study of a microbiome, right? So Vinayakji, tell me what's your population size?
Sir, I was thinking to conduct it in a tertiary care hospital, and the pre-survey would be of 1 day, so approximately 500 patients.
So 500 patients. So your population is not 500 patients. Your population is samples, number of samples you are going to study. All right. For example, sputum sample, or let's say a blood sample, or say culture sensitivity test will be your main study, right? So patient may be 500, but only 300 samples are taken, or in 300 patient also the urine sample or sputum sample. So it may be a patient of 300, but samples may be a 700 or maybe 100, like that. So you should think of the which is the unit of study here. The patient is not a unit of your study. As for your antimicrobial resistance is concerned. So your unit of study
Yes, sir.
would be a, let's say, blood sample, or the urine sample, or pus culture, or blood culture, something like that. So in that, the body fluids or body part which you're going to take, that you should go to the microbiology lab and try to see what are the type of specimen, then which kind of bacteria you could find out, then which antibiotics or antimicrobial resistance, not resistance, and the virulence test if you are going to do it, or if you're defining a strain, etc. So that kind of data set will be with you, okay?
Sir, actually, I was thinking that uh, in the survey, we will include the questions like what are the trends in prescription of the antibiotics? Like, is it oral or is it intravenous, or what type of antibiotic is prescribed, and was the culture sensitivity done before prescription?
So when you prepare your tool, it will be a basic criteria of the place, basic criteria of the patient, basic criteria of the timings, like that. Then regarding the prescription given or before prescription, the tentative diagnosis or the organ affected or the disease pattern, and then comes about the medicines, and then also comes about these which kind of samples were taken, and then which kind of the bacteria was identified, and which the antibiotic was resistant or sensitive. If the tool will be the long one. In this kind of thing, if you want to do the detailed study, there is something like linkage of the data, that kind of thing is available. But for time being, you just keep the data, the continuous data like this. And then at the end of study, let's say you have around 300 patients, but then in 300 patients, you will have a record something like 300 into medicines and the microbiome. You will have something like 3,000 data out of 300
Yes,
patients.
sir.
Because when you want to find out bacteria's different kind of one bacteria, but there can be a 10 microbial, antimicrobial scene, and each one has a different kind of resistance. So
Yes, sir.
you should decide that kind of data study. And then while analyzing, also it looks complicated, but then when you analyze, keep a focus that in Streptococcus you want medicine, or Staphylococcus which medicine is useful, and which antibiotic was given today, because you want to find out whether the antibiotic given was appropriate or not. So, and then after your intervention, in intervention do you have the control group or not?
No, sir. In intervention, I was planning to have a counseling session with the physicians or the hospital staff, so that we can, from the data already we have,
But
we can recommend changes to them, and after the changes are implemented, we can again collect the data to find if it is effective or not.
But will you be taking only one hospital, or you will have other hospitals also?
So initially, I haven't planned anything big about this project. So, one hospital I think will
The
be sufficient enough. And if
best
it
thing
is,
is that Yeah, the Panthin is too small now. First MBA student, but she can connect to your second MBA student or interns, or maybe our micro department. Then Anjali was maybe in a other setup. So when you people design your study, try to have a multi-centric study. You will be doing, let's say, testing your tool first, then you will be doing pilot study in few cases, and then try to connect with other centers, because that will be the give you the better results. That's why I'm telling you this, right? So you start preparing tomorrow itself.
Sir,
Hmm.
Sir, actually, I'm a third MBBS student, and my hospital or my college won't allow me to conduct this specific study in this hospital. So I was planning to make a proposal so that during the PG, when I get a better college or a college which will accept the proposal, I will conduct this
Can you
study
can
there.
can you find out the professor of the microbiology of your college?
Yes, sir.
Number milega. I will talk to that fellow. I will not name you, but we want to do such study in your the hospital. Will you allow us? I will directly talk to that fellow. Because see,
Sir, actually, the ethics committee of our hospital has not allowed. I have proposed this to them, so the ethics committee has only not allowed, saying due to some XYZ reason. So even the microbiology department also won't coordinate with me.
you forget all this result, ethics committee, this committee, that committee. You just hand over the contact number of any person. I will start talking. I don't want to convince those people, but I want to find out what is going on in India. When the third MBA students want to plan such a wonderful study, and if they don't want to cooperate, then you should not give it up. You float your format to us, and we'll float it to the 600 medical colleges. Those who want to carry on, let them carry on.
Okay,
Because
sir. I will try on my level first, and if it is not possible, then I'll include you.
sure, don't allow your idea to get dead, because when you become a PG, the who knows who else is going to control you. So so no matter what happens, you should continue your study in any other setup, and you may do it doing in terms of PG, but you continue your idea. See, in our medical college, I'm talking of many years ago, maybe around 30 years ago, in NHL Medical College, our interns did a wonderful study. They found out from the data that which infection is common among patients. Among the common infection, the infectious disease, which common is the organism. Among the common organism, which are the antibiotics which are commonly useful. And then we suggested that every month this data has to be given by microbiology department to each and every clinician. This should happen. And Vinayak, don't give up. This is a wonderful idea. And if in our India, every month, this data goes back to their own hospitals, it will make a 50%, minimum 50% difference in the right choice of the antibiotics which you are going to take it. And remember, the old people like us are not going to do such a wonderful study. You people are going to do it. So we'll prepare a format, we'll float it all over the at least India. We'll prepare a common for it in AP-Info or in the PHP program. We'll prepare so that we can capture data from everyone on a single platform, and then we can do analysis. And the AP-Info gives you an idea that automated analysis is given. There is a series of the commands which you're going to use. You just use the same command, and that program will be saved. And next time you can run that. And you add one command, center-wise, you will get center-wise data automatically. So AP-Info has that power. So don't get disappointed and continue what you are thinking is right, right? I can also.
Okay, yes, sir.
Yeah, please go ahead.
Sir, I have doubt regarding how should I present my data in the proposal. I mean, the basic idea is this, but statistically, when I'm presenting it, how should I present this data?
So that is a very, that's why we are discussing. We will find out the before and after prescription practices has changed or not. We can divide the prescription into three parts: a rational prescription, irrational prescription, and borderline. You cannot define, right? So
Yes, sir.
according to it is good, but micro it is not good, something like that. So pharmacologists we can bring into picture. See, I will give you a piece of information. I have a group of more than 3,500 doctors on my mobile, and I would be glad if you can take up some of them with you. I have divided into 20 parts: microbiology, then the pathology, pharmacology, like this. 20 groups are there. So, see, if this is a microbiology related project, I just put the project on the group of around 200 microbiologists. I'm sure that 30, 40 will agree that we would like to continue this. So your analysis will tell that initially in your hospital, staphylococci had the resistance to 3 antibiotics or 4 antibiotics. Now, after these 3 months or after 6 months, staphylococcus is resistant to only 2 antibiotics. And
Yes,
then
sir.
you can convert into the data, the number of antibiotics, now you're like this, and mean number of the antibiotics we can compare and find out. So this kind of analysis can be done, or the rational, irrational, and borderline. Initially, you had analyzed around the 300 or 400 or 1,000 prescription. After you are again 1,000 prescription, try to find out standard of difference to proportion, like that. And the tables command you are going to use in AP info. So if once you start preparing your format tool, try to get data of 10%, and then you present in over here that this is my data, how do I analyze it? And you will send me by email. I will share my email ID today in the group. Share me in the email. I will also think on that AP info, the Excel file, and then we'll analyze that. That is the core of this, the group or the study, that you collected your data, you analyze, and you present it, and you understood, right? And
Yes, sir.
anything else?
Sir, initially, if I do with the sample size of, let's say, 50 patients or 100 patients, is it sufficient?
I would say to test your tool, 5 patients is sufficient to test your tool, right? And then for your pilot
Yes.
study, you can collect data for 30, 20 patients, 40 patients. We'll try to analyze this data, right? Once that is done, then if your college is not allowing to do it, we'll float all over the India. And my ambition is that once you people grow up, maybe after 5 years or 6 years, forget the boundary of the nation, go at international level and let the data collection occur at a world level and try to get knowledge from each other. And you are talking about antibiotic, I'm talking about the alternative medicine also. Those who are taking, let's say, Giloy, those who are taking Nimcha, something, or changes in the dietary pattern. I will give you example of the tuberculosis. The tuberculosis nowadays, resistance, multi-drug resistance, and then XDR. Why this has happened? Because the dietary part was ignored. And then they came on concentrate only on the microbes. And that's why there's a big story why this kind of resistance came out, and 18 lakhs rupees for drugs, etc. There's a political issue. We don't want to intervene, but you'll be able to see the global, the results, right? Anything else?
No, sir.
So, should we switch over to Dr. Rashmi? We are talking about which kinds of the study you are going to do, which test you are going to use, which strategy or which kind of the epidemiological method you are going to use, case control study, cohort study, like this, and how we are going to analyze the data in AP info. That's what we have been discussing. So if you have chosen any topic, please let us know which topic you are going to do the study.
Sir, it is regarding tuberculosis only, sir. The study design is a case control study. It's about like favorable and unfavorable outcomes of the treatment after starting of the treatment. So here I was thinking about uh, in terms of mean, standard deviation, and proportions, and to use chi-square test to analyze the data.
Yeah, I want to use the all the 5Z in your data. So how do you use that? So let me tell you, you have a
Yes, sir.
tuberculosis patient, right? You have two groups,
Yes,
favorable
sir.
and non-favorable. So first, the first criteria, if you want to use our Z, that you want to find out population parameter based on the sample parameter, sample variables. So what you're going to do, that you have two groups, but if you make it a collectively one group, right? Collectively one group. So how many patients took the the how many number of days the patient took a treatment? You have, let's say, 300 good recovery, 100 less recovery. 400 patients are there. Now we want to find out how many days the patients are taking medicines. So out of 400, we are taking 40 patients. And based on that, we say number of days medicines taken. So we'll have the mean number of days and we'll have the sample size 40. Based on that, you can find out what will be the mean number of days taken medicines for that 400 patients. So mean plus minus 2 standard deviation will give you the mean plus minus 2 standard error will give you the number of the days, how mean number of days the whole population has taken. So that we are using standard error of mean. Because based
Yes,
on
sir.
sample, we want to find out about population. Now, suppose I want to find out the use of standard deviation. So I'm talking about small sample. I have only 40 or 50 people, and the patients are coming from different villages. What is the mean kilometer traversed by patients are, let's say, 30 kilometers. One patient is coming from 90 kilometers. Is significantly away or not in this group? For that, you need to apply mean plus minus 2 standard deviation. That will give you whether the patient is coming from too far or not. So this is how you can use this thing. Now you want to compare between mean. So mean duration between two kind of patients, good recovery, less recovery. So mean number of days treatment taken or mean duration traveled to the hospital. So such kind of parameter you can find out, or even you can say the peak flow meter. So the respiratory functions, their mean respiratory function over here, mean respiratory function over there. That also you can compare. So standard of difference to mean. As a proportion is concerned, regular taken or not taken. Regular taken or not taken. So that is you can compare between two groups. So this is how you should try to utilize the statistical methods in your own setup. And that will give you a lot of the insight. Then in all your study, you will have two kinds of variable. One, from which you can find out proportions, other from which you can find out mean. And then make the matrix on x-axis and y-axis, or I would say the column and row, put same variables and then compare which to compare with what. And then you will multiple things will be there. If you have 10 variables, 10 into 10, that is the 100, minus 10 is the 90. Divided by 2, there's 45 tables you will have. So in your, if variables is 20, you have so many things to compare. So try to prepare tool, try to prepare a database in Excel or maybe through EpiInfo if you're comfortable. And then you should give that Excel file, simple Excel file in a group, and then we'll be doing analysis on that. And all of you should try to do the analysis before we Meet. So on the 26th, 27th Monday, we'll be doing the analysis on your data. And if you don't have a time, just prepare hypothetical data, at least 10 variables, and then it will be very useful. So in tuberculosis, what I understand, you should try to find out why those people have not recovered in your case control study. What was the behavior with those patients? Where they were coming too far, they were too poor, they were less
Yes,
literate,
sir.
more literate.
Smoking,
Yeah,
alcohol consumption.
yeah, alcohol consumption. And if time permits, you should do the interventional study. That means if you have 100 patients or 500 patients in your tuberculosis center, I would recommend give Chyawanprash to 250. Don't give to another 250. Go for randomized control trial. You will see the results. Or if you have access to Ayurvedic doctor, all 250 doctor before they give a Chyawanprash, let them test by Ayurvedic doctor, and according to Ayurvedic prescription, give them, and we'll see the results. And I am confident that out of 250, hardly there will be one or two the resistance. If other people have out of 250, if there are 2 or 5 or 6, here it will be a 1 or 2. So if you do this kind of study, it will be a very useful for our country. Any question?
Yes, sir. I'll think about it, sir.
Yeah, and because the intervention study is very good. So,
Yes, sir.
Pantini, you have any question in mind?
Sir, like as you suggested, like the data I had collected about the our class only, first year MBBS students. So can I use the same data and analyze it after?
You should try to analyze the data first in
Yes.
APInfo,
Yes.
and then you should not give the study. Now you have,
Yeah.
let's say, around 800, 900 medical students in our college.
Yes.
So same format will change a little bit.
Hmm.
We float that refined, I would say, refined tool to all students of our college, and
Hmm.
we'll recommend if interns also would like to join. We will remove the name part of it. We don't want to any
Yes.
identity. We'll remove the telephone number, email. We don't want anything in that.
Hmm.
And we
Yes.
know that if there is no identity, they can do a mischief also. But there's no
Yes.
question because
we can
yeah, we are doing it for the purpose of learning, right?
Yes,
But
sir.
then once it is a robust study is defined, then in future we can put it across the medical colleges of India.
Yes.
And we can take their consent, we'll take their name, phone number, etc. We'll keep it confidential, and we'll ask them to give us data on the alcohol and tobacco and drugs also.
Yes.
If they have confidence on us, they will provide us data, and we'll write that based on your data. If you give us a consent, then we'll also do a counseling for you. See what is the college which is going to train the doctors, which the doctors we were going to take care of the health of the people. Those students themselves, 60% or 70% are suffering from one or other ailment. How do you expect that these students are going to be doctors and going to make the society healthy? Anyway, this is none of our part. But any question regarding epidemiology, research, and the statistical, etc.? Any question?
Sir, actually, I'm still on the second lecture. So first, like the recording videos, like they had shared me the recording videos, and I'm on the second one. So, like I'm still learning all the new terms and
Okay,
all.
you
It's
finish
very,
all the rest of
it's a
the
bit
videos, and then you
difficult
can
for
come to the questions. No problem.
Yes.
So I hope that what about non-parametric tests? Have you gone through that? I will just quickly go through the material which I have shared with all of you, so that if you have any question that.
So can I say something, sir? So I will put my project which I have done, And
Mhm.
then can you explain us how to, it's really difficult, sir. We have to sit and really read that AP info, how to put our all data into that. Can you give us a demonstration? Is there anything like a demonstration to do?
Uh,
We have
Right,
calculated the, huh?
right now, I can give you the demo. It's so quick. It will take not more than 5 minutes. Let me
No, it is
share.
difficult, sir. I am really telling you, it's difficult for us. We don't know what to put and where to put what. That was my main problem. Now, if
Yeah.
I take only my 5 students out of, okay, 10 students, out of 5, I have divided here, divided there, and I have given that exercise to one and that. And now how to fill this data, where to fill? That is the problem. So I wanted that guide properly, how to
So
fill it. And
you can share me your data,
yes, sir, I'll share
and
it.
then we'll put on the AP info, right?
Yeah, so give us
Yeah.
a small demo like that, how to fill and what to fill. And where
See,
should we store our data, and that goes into that AP.
okay, I will just tell you. The as far as this concerned, share. See, everything you cannot put in the AP info. You don't think that you'll be able to do
Yeah.
everything with AP info.
Yeah,
AP info.
yeah.
Before you start using your own data for the AP info, go for the data given by themselves. How
Ha,
given data, and that's why
yeah,
I have given you
correct.
you start
Yeah.
with classic.
Yes.
That's why
That,
you should be able to locate your sample file. So this is
huh.
read
Yes,
and
read.
then
Yeah. Project. We went into.
browse. You have project files.
Yeah, and from that project, we went into the sample. Yeah.
Apart from sample, there are so many files.
Correct.
But then I have not used all the files. I'm using the Oswego file because I
Oswego.
see that. You can see
Okay.
others also.
Yes. Then,
So it will read that. And how that Oswego file came from somebody did a data entry. How to create the data entry format that goes from the first menu which I have shown you. From that you should enter the
huh.
data entry format also to be prepared. See, it selected 75, right?
Okay.
And you can see these by the list
Please.
command, you can see the data. You see, you can looking at the data, right? And then vertically also you can see the data, right? This is your data, 75, right? Now you
Okay.
use the before you use. I think you should have the printer ready. Print करना चाहिए.
Huh.
And frequency में you should not print everything. Whatever the variables you can take, or and then if you get it a print, then you will be able to understand what you would like to compare, whether cakes and chocolate or chocolate and illness, like that.
Okay.
And if you use frequency, this command, frequency, the star, then, but at that time, you don't want, for example, the name, right? So you can say the frequency of all the things except name, because name you don't want to analyze right now.
Correct. Yes.
First select which you don't want. So that now once you give accept the name, everything will come. Here they have given the name, but it should not have come. There is some problem in that. So it gave probably only name. So I think except we said that name. I think it doesn't accepting this. Otherwise, it should accept at this level. So it doesn't do it right now. Otherwise, you can exclude that. It took only this age. Let's say the chocolate and all except I don't want to take a now star. So all these two except baki ka le liya. Let's say I was doing a mistake. So it took everything except those two variables which I have given.
Yes.
Right? Everything is taken. You can see like this. I forgot that command anyway. So you accept what you should say, accept the things which are not going to useful to you. The maybe this like global record ID, you don't want it. It automatically includes in that. So you can select such things so that you can get accept that, right? All accept that. Anyway, then you can use
Okay.
the tables command, right? You want to find out between the chocolate and outcome is illness, right? It will give you like this. So chocolate taken and not taken, illness yes or no. This is the analysis you will get. And also will get p-value. P-value in this p-value you should see two-tail p-value. 0.07 is more than 0.05. So you can say it is not significantly related between chocolate and the illness, right? If it is less than 0.05, you will say yes, it is related. And then if you go for tables command, the vanilla, see, you need to use it most frequently because we are here to understand statistics, epidemiology, and research methods. But the AP info will help in understanding the analysis part of it. But you should be using it. Because AP info alone, if you want to learn, it takes around 10 or 15 or 20 hours. Still, it will not be completed.
Yeah, okay, sir.
This is how you can, this is highly significant, 0.00. So it's very significant between vanilla ice cream and illness. And I was talking about the health. It will go to the internet mostly. And then you go for the manage data. In managing data, you use the read command, then you use other commands, how to start, user guide. See, it gives everything. And I would recommend that the young people like Pantini and the Vinayak ji, etc., and of course rest of you also, divide among yourself which topic you would like to learn in AP Info from this manual, from this help, and then try to have the off the record. अपने खुद के बीच में once a week. It's not that the sessions are over and then you have floated like that. In other group also, there are the 62 people learned this. You are around 10 or 12, whatever you may be. And then we'll have a single group where you will start interacting for multi-centric research study to learn from each other about the AP info, even the SPSS like that. There's a beautiful command, recover command, exsign command. They are very good commands. Right? So,
Okay. Yeah, sir.
and this is a detailed one. Your programmer will understand this to have a synthesis between various detailed program, etc. Okay.
Yeah.
Anything else?
No.
Sir,
Yeah.
will you tell us about how to write an abstract also at the end, sir, like for publications?
Yeah, there's a very, we have the format for that, and it's very easy. It's not that difficult. It's not like the study analysis. So we'll have a one session on review of literature, how you can use the automated the software for review of literature for hundreds of things, and that will give you the things it makes easier for making a bibliography, references, arranging, etc. At that time, we'll just talk around 5-10 minutes on the abstract, which you need to submit for the publishing journal, because based on that, you will be judged whether they want to accept it or not. And the hardcore of the any abstract would be, apart from the topic, your method, and in the result in summaries. But here in AP Info, the create forms. Here you will be able to create form. Here you will be able to enter the data. And here the sample size calculation, right? And here the visual dashboard. Math are very difficult. You need to have the geography. There's a software known as the QGIS. QGIS is freely available software. and ArcGIS is costing 8 lakh rupees. And that's matching the geographical data with the database and to do a study on that. But for that, you need to have a layers of the particular area, etc. So I end over here. So any other question?
No, sir.
Okay, so next time on Monday, I wish that you all will have the tool ready, your project ready, and then you will be entering the data in, if you can do it in Excel, the AP info is all right, otherwise in Excel it's okay. Maybe 10 or 20 or 30, 40 data is okay. And then we'll try to do the analysis. And today I have not gone through it, but you go through all the literature which I given to you, and whatever you can't understand, we should be doing that. I will finish all the non-parametric tests which I have given to you quickly next time, so that even a small sample size you can work with that. Okay, bye.